Hi guys, welcome to my YouTube channel. So I find it difficult when it comes to a Viva or a practical aspect to find out which vacutainer contains what anticoagulant and it's used for what test. So a simple example, when you go to a hospital, nurses or the staff will take the blood and they are taking in some vacutainers, right? So we need to know as a medical students the basic about the anticoagulants and the vacutainers and the tests that are employed with that vacutainers. So let's start. First we have is red top vacutainer. So this red top vacutainer, the anticoagulant used is none. So there is no anticoagulant in red top vacutainers, and the sample that is collected here is serum. So we collect serum, right? And also we have the tests that are employed are just biochemical tests like in serology, for example, like liver function test and renal function tests, and hepatitis antigen like hepatitis B antigen is also tested with the help of this red top vacutainer. Next we have is blue top vacutainer. So what is the anticoagulant present in the blue top vacutainer is sodium citrate. So how it acts, it chelates the calcium ion, right? You all know that we have intrinsic pathway and extrinsic pathway in case of a coagulation. So the calcium ion plays an important role in the coagulation cascade. So by chelating this calcium ion, the sodium citrate inhibits the coagulation. So the sample here is again a plasma, and it is used for the coagulation studies like platelet time and activated platelet time. We have in pharmacology, we have that warfarin and heparin. So we have INR, that is Indian International Normalized Ratio. So all these tests are being performed by the blue top vacutainer, which is having the citrate, sodium citrate as the anticoagulant. Now last we have is heparin, that is green top vacutainer. So the green top vacutainer contains heparin as an anticoagulant. It is an ideal anticoagulant. Why it is called as ideal anticoagulant is it prevents the conversion of prothrombin to thrombin, right? It prevents the conversion of prothrombin to thrombin, but it does not disturb the hematological characters of the blood, right? So it does not interfere with the blood composition or anything. So it just converts the prothrombin to thrombin, right? So that conversion is being inhibited by the heparin. So here the sample is again plasma, same, and it is used for the electrolytes, ammonia, molecular and genetic tests, as well as toxicology tests, right? Next we have is lavender top or purple top vacutainer. So what is the anticoagulant in lavender top vacutainer is EDTA. So EDTA is the anticoagulant present in the lavender top vacutainer, right? So in lavender top vacutainer we have EDTA. So what is the mechanism of action of EDTA? Same, it chelates the calcium ion, thereby it inhibiting the coagulation. So here we collect whole blood as a sample, right? We collect whole blood as a sample, and it's for lavender top vacutainer you need to remember whole blood, right? So it's used for the hematological tests like complete blood count that we'll do regularly, and also we have peripheral blood smear, HbA1c and blood typing. So for all these we use lavender top or purple top vacutainer, right? Next, last but not least, we have is gray top vacutainer. So this gray top vacutainer, we have sodium fluoride as well as potassium oxalate as the anticoagulants. So what is the mechanism of action of sodium fluoride? So this sodium fluoride which is there, it inhibits the glycolysis, as well as the potassium oxalate, it inhibits the calcium, that is it chelates the calcium again and prevents the coagulation. So here the sample is plasma and it is used for blood glucose. Yes, for blood glucose we use gray top vacutainer containing sodium fluoride and potassium oxalate as the anticoagulants, and for lactate and alcohol tests also we use gray top vacutainer only, right? So this is the summary of the all the vacutainers which contains the what anticoagulants that does they contain and for what test does they employed, right? So this is the summary of them. We have red top vacutainers, blue top vacutainers, green top vacutainers, lavender top or violet top vacutainers, and last we have is gray top vacutainers. So I hope you enjoyed the video. Do follow for more. Thank you.